So hello everyone. So now we are going to see about the causes of bilateral pitting edema. So here the first most important, so then what happens? What happens is the heart is unable to pump blood effectively into the pulmonary artery as well as the aorta, thereby resulting in a back pressure and thereby resulting in a transudation of fluid from the veins into the interstitial space and resulting in a bilateral pitting edema. What is the second most important cause? Second most important cause is liver. When there is a liver failure or when there is a liver pathology, what happens is that it is not able to produce enough proteins. The proteins are necessary to maintain the oncotic pressure within the vessels such that the fluid is withheld within the vessels. So when you have a liver failure, the proteins are not produced enough such that the fluid is not be able to be withheld within the vessels. So this happens in liver failure. What happens in renal failure? In renal failure, again the same reason, but here all the proteins which have been produced in the liver or which has been taken by the system is being excreted in the urine. So that happens in the renal failure. So all these are causes of bilateral pitting edema. There are also some more reasons. Say for example, it can also result in drugs. So what are the common drugs which cause this? One of the most commonly used drugs are the calcium channel blockers. Calcium channel blockers like amlodipine or verapamil can result in edema. This is because so when you start a patient on a hypertensive patient, when you start a hypertensive patient on amlodipine, they will be presenting with pedal edema. So that most important reason is amlodipine. And the other drug which can cause this is imatinib. Sometimes when a patient is on strict vegetarian diet and they don't add the vegetable sources, protein sources from the vegetarian diet, when they don't eat much protein diet, then that can also be one of the reason for bilateral pitting edema. And the sixth most common is pregnancy. Pregnancy can result in the compression of the inferior vena cava, so therefore resulting in a bilateral edema. So these are the reasons for bilateral pitting edema, but we do even have some more about what are the reasons for unilateral non-pitting edema. If you are from an underdeveloped country or from a developing country, if you have worked in places like that, then you will not be able to forget elephantiasis, which is caused by Wuchereria bancrofti. So this can result in non-pitting edema, and sometimes even malignancy. The breast malignancy, which can, when it presents with a purely orange appearance, that can result in unilateral non-pitting edema. Or even when the mastectomy is done and when the lymphatic channels are removed, that can also result in non-pitting edema. Another important reason is that about thyroid. So here I would like to clarify an important point. The thyroid, both hypothyroid as well as hyperthyroid, can result in a non-pitting edema. How? The hyperthyroid is caused by Graves' disease. Hyperthyroid caused by Graves' disease results in pretibial myxedema. So what is pretibial myxedema? Because of increased glycosaminoglycans which get deposited in the pretibial shin area, they will be presenting with non-pitting edema. But even severe hypothyroidism, which can be seen in Hashimoto's disease, can present with myxedema. So here you should not get confused between pretibial myxedema,